This lecture will cover Chapter 60, Dematiaceous molds. Dematiaceous fungi are characterized by their dark coloration, and this is due to their ability to produce melanin. They are agents of superficial and subcutaneous mycosis. They affect the skin and subcutaneous tissue, and they are ubiquitous to the environment. Humans and animals tend to be accidental hosts. And they are also classified into slow growers and rapid growers. So the slow growers usually mature within about 7 to 10 days, whereas the rapid growers mature in less than 7 days. Sometimes it only takes a couple of days. So here we have a list of the ones that are slow growers versus the ones that are rapid growers. The superficial mycosis caused by these fungi include Tinea nigra, which is a skin infection, and Black Piedra, which is a hair and scalp infection. The two other superficial mycosis we've already covered, which is the Tinea versicolor and the White Piedra. And again, these organisms affect that skin and hair and nails. So they are also diagnosed through the appearance of the lesion or how the infection looks, but also by skin scrapings and looking at the hair shaft. Hordeae wernickeyi is the cause of Tinea nigra. So it causes these brownish, black looking flat lesions on the keratinized skin layers of the hands and feet. And it's common to Central and North America, Southeast Asia, Africa, and Europe. And so these infections are usually treated with some sort of topical antifungal. It is diagnosed only to rule out the possibility of melanoma, because you can see that these lesions do look sort of suspicious as far as some sort of melanoma type spot. And they're typically reviewed or looked at with KOH, and the tissue fragments or the skin scrapings are looked at for any sort of hyphae fragments or any sort of budding yeast. The macroscopic appearance of H. wernickeyi growing on an agar plate will appear as can start off as a yeast-like look to it, and it can usually be dark as seen up in this top image, or it can be a little bit more of an olive color, and it will start off sort of moist and shiny, yeast-like, but then with age it can start to have more of a mold type look to it. So you can see this colony here where around these periphery edges it has started to get a bit of a mold-like look. For the microscopic appearance, septate hyphae, so you can see this top image. It's a little hard to see because it is a darker colored mold, so you can't see those septates too good, but if you look at this bottom image you can see some of those divisions. And it does tend to have a yeast-like look, and with these images you can see how these cells look almost like a little yeast sorta, but these are your annelids, and you can see this bottom image where one of them is coming off and it's starting to bud off there. Piedra hordeae causes Black Piedra, and this infects the hair, which forms a black stony type nodule that cements itself to the hair shaft. And these can be seen with the naked eye, or it can be seen microscopically. So in the top you see a microscopic image where it has formed on the outside of the hair shaft, and at the bottom you can see those dark filaments or those dark deposits on those hair shafts. These can be found in, this infection can be found in Central and South America, Southern Asia, and Africa. And it's been thought to be acquired through swimming in rivers and stagnant waters. And it is treated by shaving the affected area. It can be examined through a KOH prep, and this is done by placing that hair shaft with that nodule on it in between two slides and crushing it with that KOH present. And that will usually reveal the oval asci within that microscopic view. And within this, you will see 2 to 8 aseptate ascospores within that. This organism is a slow grower, so on a agar plate it will appear as a small folded dark brown to black colony. So you can see here at the bottom where it is a smaller colony. It doesn't cover the whole plate. And so you can see how you have the organism growing here. But then when you look out here in the agar itself, you can see where some of the reddish brown pigment has diffused into that agar. For the microscopic appearance, it does not penetrate the hair shaft, so you can see a larger image of it formed on the hair shaft, and then you can see it zoomed in where it does not actually penetrate the hair shaft, but rather forms on the outside edge. And this organism is a very septate organism. So if you look at these hyphae up here in this top image, you can see all of those divisions very easily with all those septa forming within those hyphae. Subcutaneous infections are divided into 4 categories. 3 of those are caused by these organisms, and the 4th, the sporotrichosis, we've already covered with our dimorphic lecture, so we won't touch on that again. But these infections cause lesions that usually start from some sort of trauma that inoculates the site. They're common in the tropics and subtropics. And with these organisms, they do tend to form some sort of granulomatous type infection. And so by looking at the granules that this organism forms, which contains the hyphae of the organism itself, it can help to narrow down what type of organism is causing the infection. Mycetoma infections involve a chronic granulomatous type infection with the lower extremities like the feet, but it also can happen in any part of the body. It causes swelling and a purplish discoloration with a tumor-like deformity of the subcutaneous tissue, and it can invade multiple signage tracts that will drain the pus-type material, which can contain yellow, white, red, or black granules. So the granules that actually come from this infection will have a color to them. It can progress to the bone, muscle, and other tissue that are surrounding that site, and it can lead to amputation. So with the exudates that come from different types of infection, and so this would be like the pus, it can be bacterial or it can be fungal. So we're going to look at the fungal ones. Now with the fungal ones, they can have white grain mycetomas or it can be black grain mycetomas. And so with the white grain and the black grain, it has to do with the granules. It is ID'd by direct examination with KOH or through looking at the granules and observing the hyphae. For the mycetomas, we are going to look at the ones that cause the white grain and the black grain. So the white grain are caused by unpigmented fungi, and of course 2 of these we've covered in the opportunistic lecture. And with the black grain, they tend to be pigmented type fungi. And so if you look in this image here, you can see some of those what they call black grains, and you can see where they just look like some sort of little hard nodule of some sort. So you can see several of those here all around whatever this is, this tissue that's been biopsied. Pseudolus Sharia boydii causes mastoma and phaeohypomycosis. So with this organism, you do see the white granules, soft white granules, and it can cause a variety of infections from a pulmonary fungus ball to infections of the eyes, endocarditis, or some sort of disseminated infection where it can invade the joints and the brain, things like that. And with the subcutaneous infection, you're looking for the granules, and with the more disseminated infections, you're looking for the hyaline hyphae. Your specimens could be respiratory secretions, gastric washings, skin, the cornea, and you can see an infection here of the cornea where that outside edge is infected. And it looks like maybe some type of surgery or something has taken place on that cornea. There are two reproductive forms. You have an asexual form and a sexual form, and of course the asexual form has an alternative name for that form. This organism is a rapid grower, and for the microscopic appearance, it produces hyaline septate hyphae. So you can see all those hyaline hyphae. The septa in it are a little bit difficult to visualize on this picture, but the conidia can come straight up from that hyphae, or it can come up and form in little clusters. So you can see several of the little clusters of those conidia. For the sexual form, you get this big spore with the sac-like spore with the little spores that are inside of it. So both of these have popped open for those spores to come out. Madurella species cause the black grain infection. And so with the subcutaneous tissue, you can see the hyphae fragments within that tissue. Here you can see an example of those black grains within this tissue sample here. With the macroscopic appearance on agar, it is a slow grower, and the colonies are folded with those little radial folds around the edges. And it can be a variety of colors. With the microscopic appearance, it is dark, thick hyphae, and on those hyphae you have phyllodes that are long and tapering, so you can see some of those where they kind of taper off at the end, and then you get these little flower-like structures here at the end. These organisms are temperature tolerant, so sometimes the biochemical test can help to differentiate one organism from the other, one species from the other. Exophalia genselme has soft black granules in this infection, and within that cyst that affects the subcutaneous tissue, you can have hyphae fragments and budding yeast. It is a slow grower. It starts off with a yeast-like dark colored type colony, and then as it gets older it can have a velvety type appearance. So you can see an example up top where it's starting to get that velvety type appearance to it. And it does use potassium nitrate to grow at 37 degrees. It only grows at 37 degrees. With your microscopic appearance, when the colony is young, it can have a yeast-like look, but as it ages, it gets these stick-like conidia, and so you can see how it comes up, these conidia come up, and then it has these, all of these clustered type conidia at the end, so it kind of has this like little flower looking arrangement as well. So a lot of these have this little flower looking clumps of conidia at the end. Curvularia infections cause black granules. You can have a mycetoma or a pheohypomycosis type infection. It can affect the pulmonary or disseminated type infections, affect the eyes, the brain, endocarditis, or a fungus ball in the sinuses. Specimens could be respiratory secretions, the cornea, the brain, skin, nasal sinus type washes or samples, culture samples. The colonies can appear fluffy with an olive gray type appearance. You can see an example up top where it kind of has that olive color grayish tint to it. The microscopic appearance is septate hyphae, and it can be a kind of a color because these are, melon type pigment, so you can see this image here where it's colored. But you can also see little crooks in it where it kind of bends where those conidia start coming out. So you can see how it kind of angles up with that little notch, and then you can see some little bent areas in it. And those conidia that are attached can be a little grouped as well, or they can be single. But they also will have a curved shape to those conidia, and you can see the arrows here at the bottom where they kind of bulge out in the center. So the ones here in this middle image are a little bit harder to see because they are grouped together, but here at the bottom you can see several of those where they have that bulge in the center. Chromoblastomycosis infections or chronic infections that are acquired through some sort of traumatic inoculation, where it enters the skin and the subcutaneous tissue, and then it can form a warty tumor-like look that has like a cauliflower type look. So if you look at like the head of a cauliflower, where it's kind of bumpy. And these lesions are capable of spreading through the lymphatic system. So if these lesions were looked through some sort of histology type examination, they would actually look similar to copper pennies. So you can see an image here at the bottom where they just kind of have that copper color and they're kind of rounded, similar to like a penny. So they are widely distributed, but most cases happen within tropical or subtropical areas. And we're going to look at 3 of these. The laboratory diagnosis involves direct examinations of scrapings from the lesions, or those crusted type lesions, and those are added to the KOH. And what you're looking for is those muriform cells, which is aggregations of dark brown cells that resemble stones in a stone wall. So you can see that here at the bottom where they're just kind of aggregated together, or look kind of like some round stones. Or you're looking at those ones that look like the pennies, the little copper pennies. Culture is put onto sab agar at room temp, and these are slow growers, so it can take them about 6 weeks. And they tend to be heaped up, slightly folded, dark pigmented, gray to olive to black, velvety or suede, and then the reverse side is usually black because, of course, all of these organisms have that melon pigment to them, that dark color. Clada 5-4 causes the chromoblastomycosis within the subcutaneous tissue, and you're looking, of course, for those stones or the copper pennies. With the pheohypomycosis, it can affect the brain or subcutaneous tissue, and with that, you're looking for septate hyphae. For the microscopic appearance, it is a pigmented type septated hyphae. And with these, you get the cladosporium type sporulation with these long chains. So you can see how they kind of, they're very elliptical and they kind of come up in little branches. So this top image looks more like these long branches where you see it kind of comes up from the hyphae, and then you got all these branches that come off, and then from those you have more branching. And so they look kind of like a plant of some sort or a tree where you've got these little wild branches, and then you've got these like leaves or long little limbs. And then this image at the bottom, it gives you more of a closer view where they just kind of start branching off with these little elliptical type conidia that are coming up. So they kind of elongate, pinch off, and it gives these kind of tapered type looks to them. Falciparia species causes infections with chromoblastomycosis, and with the subcutaneous infection you would see those stones or copper pennies. With the pheohypomycosis you would see the septate hyphae, and then it can also cause septic arthritis, which anything coming from the joints would have septate hyphae. The microscopic appearance would have a pigmented hyphae, and you can see also here in these images of these hyphae where they are septates, you can see those nice divisions there. There are two different species, and they both have the phyllodes, but the appearance of the end of it here is a little bit different. So both of these images have the cup shape or the flash shape color right here, so you can see how it kind of opens up. This one at the top, you can see it a little bit as well where it kind of opens up. It's hard to see that green there. This one right here, because it's so far zoomed out, it's hard to tell. But if you were looking at the second species, you wouldn't have this cup shape, so it would just be kind of blunted off here at the end with just a little bit of a shape, so it's more flat rather than where you have this visible cup. But then of course you have the conidia in clusters at the end, so again it's another one of those that looks sort of like that bunch of little flowers at the end. Fonseca species cause the chromoblastomycosis, which affects subcutaneous tissue, and you get those stones or those copper pennies in those samples. The pheohypomycosis, which can affect the brain with septate hyphae, or you can get a cavitary lung disease, which affects the lungs with septate hyphae. And with this you get air pockets within the lungs, which sounds kind of crazy that you would get an air pocket in a lung, but it causes an air pocket. With the microscopic appearance, you see a variety of types of microscopic appearances with this organism, but they do all have that sympodial type arrangement, and this is where you kind of get, instead of having a growth with things coming off, it kind of grows up and comes off, and then it'll grow up and come off, grow up and come off. So you can kind of get the little budding where they kind of bud like this. So you can see some of that here in this image where it kind of buds off, and then those buds bud off as well. So you have the buds coming off, and then the buds coming off, and then this one's starting to bud again, and this one's trying to bud again. So with the Fonseca type sporulation, it's sort of truncated. So this is like the Claudophallifolia, where once it kind of come up like a tree and it kind of started going branching off, and then it branched off more, then you eventually get those little elongated type sporulation. Where the Rhinoclaudiella, it comes up with like little denticles or these little protruding type sporulation, and then from there it starts to come off. And then you can have a mixture of all of these various ones, as well as it can have some phalloporia type sporulation where you actually get the phyllodes that come up, and then you can get the cups on top of those, and then you have the sporulation from there. So you can see a variety of it, and here this top image looks more like that Clada phalloporia, where it kind of it comes out and branches off like trees, and then from there it branches off into branches. So just know that you can see a variety of sporulation happening with this organism. Phaeohypomycosis is just a general term that describes infections caused by any sort of pigmented or dark type mold or fungus, or yeast-like fungus. And so these infections can be subcutaneous, localized, or systemic. It's caused by a variety of different funguses. You know, some of those we've already covered previously in this lecture. And it infects a variety of organ systems within the body. These symptoms can sometimes be neurological, where it causes things like headaches or seizures, things like that. These organisms are also divided into rapid growers and slow growers, and some of these we've already discussed, so they won't be covered again. Alternaria causes a variety of infections, so not only the phaeohypomycosis, which affects the subcutaneous tissue with septate hyphae, but also a variety of other things like the sinuses and the nails, the skin. With the microscopic appearance, since this is pigmented, it will appear golden brown without any sort of dye. It can have simple conidiophores, and sometimes those are branched. You also have large conidia that can kind of resemble like a drumstick, or chicken drumstick. So you can see some of those here, how they kind of round off. And within these, if you look at this close-up view here at the bottom, you can see where each of those conidia have horizontal and longitudinal type of septa in them. So you can see how you have some kind of come up and around, and then you can see this one here kind of comes out. So you can have them kind of affect the organism a variety of ways. So this one's kind of comes across, but then some of these at the bottom kind of come up and come over. So if you look inside of that conidia, unless you're zoomed in really close, then you really can't see very much of that. Bipolaris also causes a variety of infections, and so those are listed here. With these organisms, of course, they do have that pigment, and you do have that geniculate type bent structure within that conidiophore, where the conidia attach. So you can see up here at the top where it is bent, where they're all attached. They are elongated conidia, so you can see that long structure. And they are sympodial, where they have that alternating type attachment, where they kind of come up and then off. So you can see here at the bottom where they all kind of come up and then a new one forms. So you can see that division in between those where the new conidia come off. And you can also see right here this little protruding hilum right here up top. Most of them you can't see it very well, but you can see it a little bit on this one. And you see the septate hyphae, of course, all of those divisions. And some of these can actually, once they break off, they can have a germ tube on one or both ends. Of course, that's what makes them bipolaris is the fact that the germ tube will come off of both ends. This one here at the bottom may be trying to start one. It's hard to tell because the image is cut off. But you would have the conidia with the germ tube starts to come out from it on one or both ends. You would start to see that start to pouch out. Exorohelium species cause a variety of infections. With that microscopic appearance, you are seeing that geniculate type bend to the conidiophore again. So you can see where those conidia attach. You've got that little bend in that conidiophore. These are also elongated, so they have that long shape to them. So you can see how they're kind of elongated out. They also are sympodial, so they kind of alternate off. So they come up, produce conidia, then it comes up, produces a conidia, and then this one branched twice. You also have that helium at the end, so you can see that little point there at the ends of these, all those little arrows. And they are multicellular, so within those you have all of these little cells in the inside of them. So you can see those real good here in the center image where you have all those division. And you have about 5 to 9 of those with the perpendicular septa in between those. So they're all kind of divided straight across. Exophala dermatitis causes a variety of infections. It does not use potassium nitrate, and it grows at 37 degrees as well as 40 to 42 degrees Celsius. The microscopic appearance, it has septate hyphae. The younger colonies will have a yeast-like look to them, so you can see the image here up top where this is probably from some sort of tissue preparation, where you can see some little yeast-like looking cells where they kind of have some hyphae coming out. The colonies themselves with a filamentous look to them will have these little stick-like conidiophores, and at the end of them you will see how they have these little clusters of conidia at the end. And you can see this top image where you have those long, slender, stick-like conidiophores coming out with all of those clusters of those conidia coming around it.